Ladies and gentlemen, thank you for joining the Global Health Forum. COFI started to organize and host the Global Health Forum every month since last September to lead discussions on global health issues. We hope different ideas and topics suggested through the forum will help raise the value of health cooperation and set the norms in the international community. Today, we are pleased to invite Dr. Flavio Salio, Network Leader of WHO Emergency Medical Teams. He will give us a presentation under the theme of the evolution of emergency medical teams, what the future holds. Please welcome him with a big hand.
Good afternoon, everyone, and thank you so much for the invitations, and a pleasure for me to present today. I will be presenting the evolution of the EMT initiative that started back in 2010. I will show you a video as well that reflects the experience, the past experience of the initiative, and what the future will hold with the current EMT 2030 strategy that was launched very recently by the initiative. Allow me to share very brief my screen. Technical issue from my side. I think I will start, and the first part of my presentation is, as I say, just a video will give you in 2 minutes where the initiative started.
12th of January, 2010. A catastrophic 7.0 magnitude earthquake struck Haiti. Despite the unprecedented international response, the lack of coordination urged WHO and partners to set standards and establish a coordination mechanism for foreign medical teams. May 2011, WHO creates a new work stream to prepare for and respond to health emergencies using an all-hazards approach. December 2011, the first working group on FMTs worked to develop registration procedures and minimum quality standards for the teams. May 2013, the WHO classification and minimum standards for emergency medical teams are released. November 2013, WHO standards are successfully used for the first time during the Super Typhoon Haiyan Philippines response, with 151 medical teams deployed and coordinated in the response. July 2014, WHO mobilized EMTs for the Ebola outbreak in West Africa with 58 teams deployed over the course of the multi-year response. January 2020, before the novel coronavirus outbreak is declared as a public health emergency of international concern, WHO issues an alert to mobilize teams in response to what would become the COVID-19 pandemic. In 2021, the classification and minimum standards for emergency medical teams was updated with a much stronger focus on developing national emergency medical teams, shifting the focus from international teams. That same year, a guidance document for EMTs in armed conflicts and insecure environments was also launched. 2020 to 2021. Over the course of the first 2 years of the COVID-19 pandemic, over 1,000 national and international EMTs were surged in to provide hands-on support where most needed. Since February 2022, since the beginning of war in Ukraine, EMTs have operated to provide health services, support the health system, and help build Ukrainian EMT response capacity. Emergency medical teams provide direct clinical care to people affected by emergencies. All team members are fully trained, have the skills appropriate for the situation, and bring with them their own equipment and supplies.
So a very introduction of the initiative. I'm trying to move the presentation mode, but I think it's still stuck in the same way. So apologies for that. But I will just move meanwhile. And I don't want to take time to the presentation itself. Starting from the experience of back in 2010, as you can see, we started looking to what is the future holds. So when we are looking into the current situations and the projection to 2030, we could see a projection of 1.5 disaster per day worldwide. We're starting to see 187 epidemics event per year, with this number increasing over the time. We're starting to see, obviously, fragile and conflict-affected setting in increasing in a negative term, and over 103 million forcibly displaced worldwide. So it's clear that when we look into these numbers and the projections to 2030, it's clear why investment need to be made at country level and by organization to cover this gap and support it, those affected by emergencies. So the emergency medical team you have seen in the video. So it's the initiative look to building up a team and system that allow to provide life-saving care, intervention and services to crisis-affected populations. We look into 4 major pillars as part of the initiative. Time, and I will present in a few slides why obviously it's important. The appropriateness of the services provided by the team, safety of both staff and patient we serve, and the element of coordinations. You can see in the video the chaos of Haiti 2010. We have seen as well in recent responses a more coordinated approach, international team getting more better understanding of the mechanism, while countries starting to invest in a more systematic way in national teams. That part on the initiative. So 3 major as well pillar, like we call. So the capacity building, as I say, of countries and team. The investment, a major investment on setting standards and define a quality assurance system. The quality assurance system back in 2016 has seen the launching of a global classification for emergency medical team, where a team that they want to deploy internationally on voluntary base apply to the system. The evolution of this classification is going to define system at country level to validate those national teams. And the last part is investment on the emergency response, and I will touch all these 3 elements in my presentations. So last recap on the initiative. As I say, core and technical standard defined, and then we'll go into the details in the presentation. The classification system that see today 38 international team classified, while around 100 already in the process of classifications. Investment of requirement at country level to build teams and to build all the support services and system required to be able to activate and respond appropriately to any kind of emergencies. Then importance as well of what we call the EMT community. So becoming part of a network in which no matter if I part of the workforce of an international team or a part of the workforce that work in my own countries, I can exchange and be part of what we call a big community of practice globally. Why the evolutions on the strategy? Back 2010, emphasis was made on foreign and international, but it's clear that it's important to build in my own country those capacity that are better placed to respond, and then upgrade those capacity to be able to then offer assistance to my neighbor. And this is actually the concept of building national capacities and then ensuring that those are made available regionally and globally. But when we're looking back to the type of events, so we do see on the left side, we do see the situation of Haiti and in general of a sudden also disaster. When we look into that type of event, you could see the example of an earthquake. You could see there is an importance of speed to be able to respond to the initial peak of trauma cases that are expected in the aftermath of the earthquake, but then as well ensuring that all the other elements that are part or indirect link with the event are addressed. And obviously, I'm referring to all their indirect causes of the event, as well as exacerbations of situations that are pre-existing prior to the event, and then all the elective, for example, surgeries that are initially put on hold to cope with the increased requests, but then come back when I clearly on the second phase of my response. And that's what we try to look into with what we call the Blue Book, so the classification and minimum standards for EMT. Then what you can see on the right side is, for example, the example of 2016-2017 Iraq situation, in which then we started to look more to how an insecure environment or a conflict environment looks like. So we look into the left, from the left to the right, you could see the changes clearly on the requirements. We start to see the peak of trauma that become more in waves, so that need to be significantly addressed on a recurrent base. And then we still have as well all the non-trauma emergency type of presentation. They are still constantly come to my facility. So to address these differences when it comes to working in insecure environments, as you have seen in the video as well before, we have published the classification, the guidance document for medical team working in insecure environment and conflict. And then we are currently finalizing as well the addressing the response to outbreak in both contexts. As we have seen, is quite recurrent to see increased risk of infectious disease outbreak in both contexts they just presented. And the work that the initiative has done, thanks obviously to support of different experts worldwide, will be producing a guidance document that will be available by the end of this year. It will clarify obviously those capacity that need to be invested, in which period of the response as well are required. So when we look back to where we are in terms of what is the initiative we are addressing, first of all, addressing a surge system. You could see here the pyramid of the building block of the system, which you can see on the bottom. We talk about my investment on routine care system, starting from my primary care, emergency care, critical and operative care. And then it's clearly the requirement as well on addressing specific element of an emergency. I'm clearly referring to how to address the element of mass casualty, the element of mass gathering, but any other type of events that can be addressed in terms of the emergency itself. And then obviously the specialized requirements that need to be on top of this investment in way to be able to cope with specific type of event. For example, complex injury that might be or reconstructive surgery that might be addressed, or intervention when it comes to CBRN. You can see the importance of investing in the bottom of the pyramid, so investing in my system, starting from the primary care, but then adding on top of my investment to the routine services, specific training, specific element of the system to be able to respond to emergency. So the two are complementing each other and are extremely important when it comes to investing in both the time of preparing for a system to respond to any type of emergencies. Then the system goes together with the surge plan. So surge planning that it's extremely important, and the proposal go into a tiers approach. So we part of the initiative we are coming to support to be how I invest in supporting a single facility that is affected by any type of emergency. How we look into strengthening a network of facility, maybe, for example, in a district or a administrative region in my country. And then when will be the moment in which I need to expand to alternative sites or temporary facilities. We have seen as well during the COVID, it's how much this is important element. But the reality is that when we look back to the concept of surge capacity, for the concept of disaster medicine, that is clearly highlighted and emphasized since many years. So then you could see the element of how the EMT structure from the typology of a mobile to specialized care team can complement the 3 tiers that I've just presented. But then how we address the building up of those capacities. So if I'm individuals, and clearly I go through steps of addressing my personal skills, but then being part of a team does require actually a number of what we call domains that need to be addressed by any type of institutions when it comes to building up an emergency medical team. You can see there are 8 domains in which HR and training is one of the components. We see that significantly investment and focus is on training. Then training need to be accompanied by a number of other elements, such as investing on my clinical capacity and capability, investing on plans that allow the activations and the coordination of those teams, and then investing as well on the looking to reviewing my own experience post-deployment and try to readjust my system each time I deploy. Then we look into around, there are clearly 4 elements that a country, and that's specifically to a country, need to be addressed. The legislation, so how the importance of embedding, including the initiative as part of my day-to-day activities, and as well as including by law in terms of the activations and the coordination. A dedicated coordination mechanism that allow to apply the tier system that I just presented. Defining a surge system that is from the national to subnational level, it's addressed, and then clearly look into all the operational requirements that must be in place to facilitate the activations and coordination of the teams. When we look into the perspective of the nationals, I mentioned the importance of our strategy and how much our strategy look to investing on national capacities. First of all, I presented already the global classifications, and the linkages between the global to national is basically how I can take the lessons and the system applied for international classification and adapt it to my national and local context. So we have a clear call to actions that will be presented at the end of my presentation that look to how I adopt the technical standards and the core and guiding principle of the initiative, and then adapt it to my local context. It's a significant amount of work that from WHO perspective we are supporting, but we started to see an increased interest from country and organization to embark and engage in these type of activities. Then it's clear the linkages between the global and what we do in terms of global network and the work at national. It's what you can see in the slide in between. So how we can address the element of a more regional group of teams and institutions, and how we can facilitate the exchange and mentoring within the regions across team and countries. How the system, practically speaking, is implemented. My last slides, as you can see, I'm presenting the situation of the recent earthquake in Turkey, in which the Ministry of Health of Turkey has established the coordination mechanism at the very early stage of the earthquake, and has as well received support from WHO and peers in terms of augmenting the expertise of the coordination mechanism. Then there's been a number of teams, as you can see, that they have deployed in Turkey, and then coordinated under one coordination mechanism established by the ministry. One of the important elements that comes to the Turkey response is as well that around 30% of the teams deployed, international teams, were from the military. Clearly called for better understanding on how a civilian and military system interacts, and become as well one of the priority identified by the 2030 strategy. How the national system implemented the response itself. So you could see that there's been a significant investment as well in the past in capacity by our Turkish colleague. There were 34 field hospital facilities that were placed in the all affected provinces. There were 176 emergency response units. So you can see the adaptation of what I present in terms of global standards to match the needs of the response itself. So in total, in the first phase of the response, we have seen around almost 600,000 patients treated by nationals and internationals. Another important element of the response to Turkey was clearly the capacity of the system to invest into a medical evacuation system. So you can see that within the period of the response, around 52,000 patients have been transferred across the affected provinces. You can see that different means of transport were used as well to facilitate the evacuations of the patient. They were obviously stabilizing one of the facilities they have presented, and then brought to a safer locations where basically a facility were not affected. That's actually brought us to invest as well into what we call a technical working group of medical evacuation and pre-hospital in emergency that is currently running and supported by a number of experts globally, and aiming actually to have the final product by the end of this year. Then linked with the red book that I have presented before, it's coming basically the work that we have done as well in support of the current status of the Ukrainian systems, in which there will be a number of investment at regional, provincial level, oblast, as it's called in Ukraine. So a number of national EMT have been set and supported, as well as 5 different coordinations. So the EMT coordination system has been established to facilitate mobilizations of in event of mass casualty, as well as the mobilization of additional teams for the response itself. But then we looked as well to a dedicated trauma pathway that's we set as part of the initiative back in 2017. Then we started looking to all the necessary elements that need to be addressed when it comes to such kind of environment. Some of the elements are not very different when it comes to the blue book that I've presented. So, for example, the investment on the pyramid you see at the end, so the importance of post-operative care and rehabilitations. Clearly, when it comes to the initial part of the system pathway, there are differences in terms of the importance of the civil-military coordinations and the importance as well to understand what a civilian system can do in such kind of context, and which are the most important elements to be addressed to be able to support a civilian system to work in such kind of environment. We have as well addressed that through current ongoing working group, in which we're trying to address the element of taking existing guidance that maybe are much more focused on a military system and translated that into what is possible to do in a civilian system. And there are a number, obviously, of elements that when a trauma pathway is designed must be addressed by the coordination system. Then when we look back to the strategy, how we can ensure the linkages between a global network and a national and subnational investment. The initiative launched the first time in 2021, the first regional training and knowledge hub, and that was in Addis Ababa for the WHO Afro regions that facilitate actually cross-regional training as well. The additional 2 training hubs, training and knowledge hub, are being set. One in Indonesia, where actually this week currently there is an ongoing international training, and the third one is in Istanbul to facilitate again a cross-regional support. What is the importance of and why the establishment of those training and regional knowledge hub? First is the opportunity actually for those teams to practice in a safe environment. Second is the opportunity to bring multi-country together and practicing together when it comes to addressing specific gap that the country together have identified. And then there is an important element as well of leverage on regionalization. This means countries they share the same hazard, language, and culture. When you look to what I presented today, it's but how we can address the element of the standard setting as one co-component. I think, as you can see in the slide, there is a lot of work it's been currently addressed. I already presented a few of them in the previous slide. One that I have not mentioned is, for example, burns in mass casualty incident is another technical working group that was launching, addressing all the different elements of a response to burns care in mass casualty. And even this product will be published by the end of the year. I already mentioned a lot about investment on specialized care team, and there is a dedicated group that's looking specifically to how I can embed a team with a niche expertise into existing facility to scale up this the ability of this facility to respond to an event. And then we're currently looking as well to 2 other important elements. One is the interaction between what is called public health rapid response team set by country for specifically responding to an initial assessment and investigations of a potential suspected case, and the linkages between the EMT to ensure a streamline from detection to investigation to initial treatment and continuation of care. And another element that it mentions is the civil-military interactions. We will have a workshop in August, the mid of August, during the period of the ASEAN Minister Defense meeting. That will be actually the kickoff of the civil-military interactions working group, with the idea of looking to 3 major elements of the civil-military interaction. Coordinations, I mentioned the example of Turkey, the collaborations, or how the 2 systems interact in a different type of event, and the element of standards. So ensuring that those standards are clear and aligned between the two systems. And last, I would like to mention as well the investment of looking to a competency framework on the disaster medicine part, which attempt to clarify major element of when and how to invest into it at country level. Back to the civil military, this slide presented the lessons from colleagues from Germany that deploy in Turkey. As you can see, was the first interactions with the response to earthquake, a response that was coordinated by a civilian, a Ministry of Health institutions. And you can see in the slide the element, the stress the point of clarify the element around standards, and always considering obviously how the two systems interacts, and the fact that how I should plan my exit from the beginning of the response. This clearly comes for international teams. Taking into consideration all the elements I have presented in the pyramid I have presented before, we started as well, and this is one of the strategic evolution of the initiative, are looking to how the proposition and the standard that come with the initiative can be more flexible and tailored to the needs. We have seen one example of the Turkey response with a specific dedicated emergency unit. But then we started looking to the different elements that need to be considered to be able to have a more flexible and agile system. So one of the elements, obviously, that goes with the emergency type, but then there are other key considerations: pre-existing capability, where I deploy, with the time I will activate teams, change as well the requirements, and then obviously the status of the host facilities. This slide presented the concept of the specialized care teams and the idea of having modules that are applied at existing facility, or teams that are working inside existing facility, and with the purpose, obviously, of augmenting the capacity. Another fourth element of the strategy is clearly the investment on operational research and evidence. Unfortunately, I would say today one of the biggest gaps we are seeing within the initiative is the way we document what we do and the way we document response to events. I think it's has been already addressed from last year global meeting, with the dedicated call for paper, and I think a number of additional call for paper and discussion with the journalists ongoing from the side of WHO to facilitate increase in documentation of experiences. So all the four pillars of the strategy are clearly aligned with the key global agenda, as you can see. The current discussions around health emergency preparedness, response, and resilience, the international health regulations in which the emergency medical team are already part of core competencies, the sustainable development goal, and as well as the Sendai framework of disaster risk reductions. When we look back to ongoing discussions regarding the global health emergency core, we started to see the importance of establishing such kind of rapid response capacity at countries. And as part of our strategy, we as well align and define the different type of rapid response capacity. You can see in the slide, so the component of first responders and those clinical team. But then we do have a number of other response capacity that could be prioritized and interlinked clearly with the work of the EMT initiative. Then when we look into back to 2022 and how our global meeting is clearly, you can see in the slide, the endorsement and the request for building such kind of capacity by our Director General, Dr. Tedros, highlighting basically the importance of well-trained and properly equipped emergency medical team, the role that it can play when it comes to emergency response. And you have seen as well in previous slide the number of life saved and the importance as well of speed, adaptations, and building capacity that are fit for purpose. What the strategy, and that would be something that we have launched. What the strategy is clearly mark a new evolution of initiative that, as I presented at the beginning, starting to look back to a chaos of Haiti, starting to focus more into how I can address and better coordinate internationals, to more how I can focus more on nationals and allow them to be able to strengthen their own capacities in the country and then be ready and available for international responses. I have presented with the previous slide what are the core objectives, and you can see now it's in your slide. So the major elements go to the partnership, and I think there would be soon a call for expanding the partners of the EMT initiative in way to incorporate those institutions that have expertise and experience that can be valuable to the initiative, but they don't have necessary capacity to build the emergency medical team. Then there is clear investment on more expanding the services and the standard that need to be regulated when it comes to certain technical areas. The implementation of strategies scale up a quality assurance mechanism that not only look into the international aspects, but focus as well on the national. And the last, as I called and re-stress again, the importance of investing in generate evidence and research, extremely important when it comes to taking certain decision and bring the standards at disposal of the decision makers. And the strategy as well address this call to actions. The call to action that the strategy linked with the strategies is clearly taking a proactive approach at country and organizational level and building those rapid response capacity following 4 major critical steps. You can see the first one is basically adopting the standards. I mean, recognizing what I had presented as core elements, but then adapt it to my local context. Then establish a search system at country level that facilitate rapid mobilization of my workforce. Strengthen the technical operational skills of the health workforce, so addressing the individuals, but then as well at the team level, and then documents what we do and to inform best practices. Then when it comes to generating a global network that can obviously facilitate improving of sharing best practice, improving knowledge at the level of country and individuals. Then is the call clearly of the EMT, and here where you can find the many of the guidance documents that I presented today, or you can reach out as well to the EMT Secretariat here at Geneva, and happy obviously to address any question you might have when it comes to building up such capacities. With this one, I just end my presentations and happy to answer any question from the audience. Thank you.
Thank you, Dr. Flavio Salio, for sharing your insight. If you have any question regarding the presentation, please wave your hand or leave your question on the chat box. Yes, please turn on your microphone and ask the question to Doctor.
Thank you for your insightful presentation today. We understand EMT and future strategies at WHO. As far as I know, there is a capacity building program of coordinator, especially for the coordinator program. So could you please explain more about the coordinator capacity building program at WHO?
Yes, thanks for the questions. So we do have what we call EMT coordination course that we run across different regions. The idea is we have actually divided this course. Initially, it was there is a component that's focused of international support to the establishment of coordination cells, means those experts that when they know well the methodology, can be then put at disposal of a country as requested and required to support some functions of the coordination mechanism. Then we have a second part of the course that's focused specifically to the establishment of the coordination cell at country level, and which basically explain which are the functions, why it's important, which are the elements that need to be addressed. And then both courses end with a simulation exercise and allow the participant to practice what they have seen during the week course that usually is run by WHO together with a number of experts that have been trained previously. This program started actually back in 2016 and take advantage of the lessons from the response to the earthquake in Nepal in 2015.
Yes, for those of you who have any question, please wave your hand and turn on your microphone and directly deliver the question to Dr. Flavio Salio. Yes, Ms. Yunayong?
Hi, thank you for your presentation, Dr. Flavio Salio. I have two questions. First, I think during the natural disasters, there are different laws between the OCHA and EMT. Can you share what are the different the law, and during the Turkey earthquake, how the both OCHAs and EMT coordinated between the work and also human resource? And my second question is that how the EMT team is working with other donors, especially in the low-income countries and middle-income countries.
So on the OCHA side, so we. First of all, we obviously work together in I would say in preparedness phase, if you want to talk, referring to when it comes to the interlink between the search and rescue, so the user team and the EMT, in way obviously to ensure that in an event like Turkey, there is a clarity of roles of responsibility, or better, there is a clarity on interaction, how the two systems interact, both from the perspective of the teams as well as from the perspective of the coordinations. That is actually the first part. Then the example of Turkey is OCHA as well as a well-established UNDAC system that's basically support the coordination, facilitate the coordinations of different partners responding to an event. We are currently working on a letter of intent with the UNDAC system as well to adding an additional options for the EMT initiative to deploy experts to facilitate the coordination. So the previous question was how the coordination looks like in the programs. And the answer is that we are focusing clearly on having coordination at country level, but then we'll always give the option to have experts that internationally can support the coordination mechanism. And that is a work in progress as well with the OCHA. On the side of the donor, so the part of the strategy 2030, actually, I would say the already initial success of launching the strategy back early at the end of last year is that we start to have a significant increase of what you refer to low resources or low and middle income country engagement. So if you take the launching of the training hub in Addis Ababa, for example, resulted today in 17 countries in the WHO Afro region. They have already engaged and expressed an interest to build up this capacity and being supported by WHO. And I think those numbers, to be honest, is increasing regularly, in particular when it comes as well of low resource country, which is starting to realize that I can build those capacity, but in building up those capacity, I can obviously identify immediate gaps that can be supported and fulfilled by, for example, international community. So what in the past was, if you don't have everything, you don't invest. Now it's becoming more, I want to invest in the initiative at country. So that will allow me to identify which are the requirements, but as well at the same time, which are the gaps. If I take one example of the colleague in Ethiopia, from 2021, when we started the support, the colleagues have already deployed 6 times in only 1 year. And most recently as well, the first team that deployed at the border with Sudan due to the conflict situation was the national Ethiopian EMT, and actually establishing a primary care facility. So you can start to see that element. I think the next step from our side would be more, as you mentioned, about in terms of donors, more looking at country level and explain better how this support can be provided, and can be either directly to those organizations or clearly with the interface of WHO.
And is there anyone who wants to ask questions? If there is, please wave your hand and turn on your microphone. I think that brings us to the end of...
There was a lot of content to digest, I would say, a lot of information. So, as I said before, you have the contacts, and obviously here the Secretary very keen to engage and to answer any type of questions afterwards as well.
Yes, that brings us to the end of our forum. Once again, please give a big hand to Dr. Flavio Salio for his insightful presentation. And thank you all for joining us today. The next Global Health Forum will be held in August, and I kindly invite your active participation. Thank you all.